Okay. All right, we're doing a head to toe assessment today. Mr. Anders right here. I'm gonna wash my hands, which I already did. Put my gloves on. Hi, Anders, how you doing today?
Doing good, doing good.
Good. Good to hear. We're gonna do your annual physicals assessment.
Cool.
Okay, we're gonna start off by examining your scalp. I'm gonna look, and everything looks symmetrical. Eyes, at the corner of the eyes to the top of the ear is symmetrical. Same on both sides. Alright, I'm gonna palpate your head with just my fingertips. I'm gonna do one side at a time. And I'm looking for bumps, lesions, or abrasions. I'm going below the hairline because he has hair, unlike me. And I will get sunburned. Okay, no abrasions. I'm using my fingertips. I'm gonna go to the back of the head. Looking again for abrasions, lesions, bumps, any discoloration. Hair growth looks good. Everything looks good. It's on the scalp. Fingertips, no obvious masses as well. Can you put your head down for me, towards me? And I'm gonna examine the scalp below the hairline, one side at a time. And it looks good. I already went to the back of the head. Eyes are symmetrical, even with the top of the ears. No obvious signs of deformities. Now I'm going to use my ophthalmoscope. I'm checking. You want to use your dominant eye? Okay. No, he said leave the lights on in the video. Yeah. So I'm going to place my hand right here. And I'm going to come in from the side. Want to blink for me? Thank you. All right, I'm coming in from the side. Okay, and I do see blood vessels and what was that called? I forget. Wait, put them in order. You have to do light. Okay, I'm coming in from the side. All right, I do see blood vessels and I do see the red reflex. Eyes are perla. Okay.
The other side.
And I'm gonna do the other side, and then I'm just gonna come over top. Still using. Sorry.
Very good.
Blood vessels and red reflex. Noted. Okay, and then I'm gonna come in from the side. Just look straight for me. I'm gonna come in from the side. Perfect. Right eye is perla. I'm gonna come in from the side. Left eye is perla as well. Okay. All right, I'm gonna have you look straight at me. You're just gonna follow my fingers. Just the 6 cardinal gazes or something? Yeah, 6 cardinal gazes. Okay, just follow your eyes, or follow my finger with your eyes. You guys want to come back to the midline. Perfect. All right, and then I'm coming to you. And that's a positive, I forget what that's called, accommodation. Sweet. Distribution of hair with your eyes. Everything looks good there. Looks normal. They appear healthy and full. No spars. The sclera. Pull down your eyelid and look at your sclera. Okay, looks good. All right. I'm gonna take a look at your mouth. All right, can you open your mouth and say ah? Push down. Looking at the hard palate, soft palate. Everything looks intact. Gag reflex. Say ah again. He doesn't have a gag reflex. All right. I inspected the mucosa, the palate, soft palate, hard palate. Can you puff out your cheeks for me? Blow out a candle. All right. No, okay. Can you tilt your head back for me a little bit? I want to look at your nose. Look inside there. Looks good. All right. Are swollen and red a little bit. Allergies. Septum without any deformities noticed. Okay. All right, now I'm going to look into your ears. Okay. So I'm going to place this first. And then I'm going to go back and up with an adult. Okay. And ears are very nice and groomed, and you can see the gray eardrum. No obvious signs of deformities. Up and back with the ear in adults, down and back with children. Throat. Okay. Oh, the lymph nodes. So I'm gonna examine your lymph nodes, and I'm gonna do it from the back. Okay. So the preocular, I'm gonna start up top, and I'm just gonna go down and palpate with my fingers. Okay. No bumps, no abnormalities, normal. I'm gonna do the post-article. Same, I'm gonna start high, go down. No bumps, lesions, or masses noted. I'm gonna do the cervical. Post-cervical, I'm gonna go all the way down to the base of the neck. And no obvious signs of lesions, and I would do the same on the other side. Oh, I said that, base of the neck. All right, anterior cervical. So I'm just going to come front and down to the base of the neck. Mandibular. I'm going to start right here and come all the way down to the chin. No abnormalities, no bumps, no lesions. Okay, did that. Sinuses. Okay. So I'm gonna do a little bit of tapping, okay? Sure. So I'm gonna put my finger right here, and I'm just gonna tap.
No pain.
No pain. Leave your glasses for you.
Sure. Thank you.
All right. And I'm just gonna tap.
No pain.
No pain. Same.
No pain.
No pain.
No pain.
No pain. Good. Okay. There's thyroid. Okay, thyroid. So you can do this two ways. You could do it from the front, or you could do it from the back. I like to do it from the back, like Archuleta does, and you're going to displace one side. And palpate. Looks good. And then I'll come from this side and I'll displace thyroid. And palpate. No abnormalities with the thyroid. All right. Ready? Okay. So I'm gonna find the clavicle. I'm gonna oscillate heart sounds, and then I'm gonna find the midline, and then I'm just gonna go down and find the third and fourth rib, and I'm gonna go to the third and fourth intercostal space to listen for the aortic, right? Okay, right there. Then we have to do this with skin.
Yes.
Sorry, Ander.
No, I can. Yeah.
So I'll do this again. You have some green stuff on your chest.
No. I don't even. Oh, I.
So right here. Perfect. I'm gonna go palm-like. It's right across. Perfect, sounds good. And then I'll come down. Tricuspid. Come down again. Mitral. I did that one, tricuspid mitral. And the mitral valve is at the fifth intercostal space. Okay, so lung sounds. We could go right here above the clavicle. Take a deep breath with me. All right. Same on this side. Deep breath. And then, can you lift your arm up for me? Yeah, there we go. And we're gonna find the rib cage. I'm gonna come right underneath there. Deep breath. And we'll do it the same on this side. Deep breath. Okay. All right. Okay. Now we're gonna listen to the back, and we're gonna find midline of the clavicle, correct? Yes. So right here, midline clavicle. We'll start there. I'm gonna start upper. Deep breath. Perfect. I'll just breathe normal. And I'm just gonna work my way down the midline of the clavicle. My imaginary line. Okay, perfect. Yes. So now we're on percussion and palpitation. Rib cage on the back. Oh, okay. So I'm gonna find your rib cage on the back. There it is. I'm gonna push up a little bit, and it might hurt a little bit. Okay, sorry. That's a Mr. Archuleta. I'm sorry, Andrew. That's what he did, though.
You're good.
All right. So we kept it crossed with the right hand and fist. Okay. That's checking for. We're checking for CVA tenderness there. Okay. I did it on both sides, but that's not even. That's not on the exam. Have patient. Okay, lay flat on the exam bed. Got your legs, Maria. All right, be in a relaxed position as possible for the patient. Find the lower rib cage. Have patient. Okay, I've got one there. Lower rib cage. So I'm gonna palpitate and we're gonna do like a rolling motion. We're gonna start at the top. Since I got big hands, I could do an all upper, middle, and lower quadrants. No palpable masses. Any pain or tenderness there?
No.
Okay, that's good. Now I'm gonna do some percussion, okay?
Sure.
And you're gonna do you can do nine percussions. So you put your fingertips here. And are you recording the percussions? He's gonna Des. Not even pointing the camera. Are you? She's like, yeah. Any tenderness or feeling good there? Alright. Oh, the liver. So can you put your right arm back above your head? Now we move the rib cage opened up for the liver. So, and the liver should sound hollow, correct? Yes. So the liver's, there it is. Trying to palpate the liver and percuss. Okay.
That was good.
Was it? You felt it? Spleen. Herb's point. And the appendix. Found the hip. Appendix right here. Perfect. All right, now I'm going to oscillate your abdomen. We're going to look from the xiphoid process down because we want to oscillate right in here, not on the hips. So I'm going to start in the right lower quadrant. Did you just eat, Andrew?
Mm-hmm.
Valve sounds active, hyperactive in all quadrants. Heel strike. Heel strike. All right. So I'm gonna lift your leg up, and I'm gonna strike your heel. You okay?
Yeah.
All right. One more time. All right, cool deal. We're gonna do some range of motion. All right, Andrew, can you move your right arm in a circular motion like that? And we're listening for popping or any signs of dislocation of the shoulder. Can you use your left one as well? Everything seems good there. Can you cross your arms across your chest? Both of them? Yeah, there we go. Let's stretch it out. Stretch it out. No popping. Can you reach down? Oh, so I need you to, with your right arm, can you reach back and touch your left hip? And with your left, do the same. All right. Okay. Flex elbow. Oh, can you flex your elbows towards yourself? Like you're lifting weights, doing curls. Okay, can you rotate, can you put your arms out, rotate your wrists and your hands, supination, pronation, all that good stuff. Wiggle your fingers, spirit fingers. Okay. Alright, there is no issues or concerns there, okay? Alright, have patient lay down. Okay, I'm gonna have you lay down again.
Sure.
Alright, and I will. Can you raise your leg, one of your legs up for me? And just about 2 feet to my hand. Any pain in it? No? Okay. Left leg to my hand. Okay, good. Can you do some dorsiflexion? Good. Dorsiflexion there. Nice and strong. Okay. And we're checking for lower back pain here. Outpatient raised to 2 feet. Any pain, Andrew? No pain?
No pain.
No pain in your hips or thighs as well?
No.
Alright. Okay, negative back pain. We're gonna have you sit back up, Andrew. Sorry, we got you moving all over. Alright. Can you kick up your right leg for me? Can you kick up your left leg for me and shake it all about? Alright, reflex. That's good. Oh, okay. Now I'm going to check your reflexes. So first I'm going to check your shoulder reflex. So, just go ahead and relax. Just angle your arm, okay? And I'm going to tap your right. You could either tap on the elbow or you could tap right above. And we have a little twitch there. Okay. All right. We call that the escort position, like we're escorting them down the aisle.
Damn. Just like Ryan's good as
So, okay, brachial reflex. Arm relaxed. Okay, we have your arm relaxed on your leg. And palm. Okay. And we're going to squeeze a little. Oh, dang. That really worked. And yeah, the brachial reflex is there. All right. Custom finger, middle finger. Let's see. Okay, radial reflex. Okay. Bit elbow. Okay. All right. So we're going to do the radial reflex, and I am just going to tap here. I didn't really see anything, so second time we kind of fake it. That's what he said.
Cool.
Yeah, he said second time you guys fake it.
When you first did it, like my leg moved for some
Yeah, that's what I said. That was weird. All right, so support patient hand. Okay, knee reflex, patellar tendon, hit with hammer. Bam. Okay. Okay. Perfect. Achilles. Check from side of patient, hold toes. All right. So. Yeah, it's fine. You can leave them on. Take a glove on. So I'm checking the Achilles reflex. Ooh, that's a strong reflex you got there. Perfect. There was movement in the heel and the ankle on the Achilles reflex. Okay. Now we're going to do smelling test. You smell this alcohol? Do you smell this?
Smells like alcohol.
Okay. All right. Eyes. Can you close your eyes tight? Open them wide. Woo. All right. Surprised eyebrows. Raise your eyebrows. Now your mad eyebrows. All right. Finger. Okay, we're going to do the finger, the 6 cardinal gazes. Again. It was on the video. Just going to follow my finger. Perfect. And then we'll do the accommodation one more time. All right. Okay. Can you blink your eyes to reset? Okay. Puff out your cheeks again. Kissy face. Blow up the candle. Okay, hearing test. Do you hear that?
I do.
What's that?
It's like paper.
Okay. Hearing's intact. Okay. Okay. Next, so we're gonna check the strength of your neck.
Okay.
So I'm gonna put my hand right here and just push your neck to the left towards as hard as you can to my palm. Perfect. the same over here. Okay, now go back and now forward. Strong neck muscle. Okay. Can you shrug your shoulders up and down? All right. Okay, and you did push your head forward. We did that. Okay. Put your hands out like Frankenstein. Move them around. Spirit fingers again. Perfect. Coronation, supination. Oh, patty cake. Can you do patty cakes for me? All right. And we're checking for any brain injury here and there. Everything seems fine. All right. Can you, with both your hands, can you squeeze both my fingers? Grip is there bilaterally. Kick out your leg again. One more time. All right. Do the hokey pokey. All right, now we're gonna have you stand up. We're gonna check balance. So we're gonna close your eye. Okay, close your eyes. Put your both arms out to your side. Look up. Perfect. And then I would be standing on the side of him, just in case his balance was off. Okay. Arms, okay, now put your arms aside. Open your eyes. Blink. Lift your left foot for a couple seconds. Okay, now let's do the same with the right. Perfect. All right. Everything was checked out good. You assess on spine. I'm gonna listen to your carotid. I'm gonna listen to your carotid arteries, one side at a time. No thrill, no brewery. Right side. Okay. I'm gonna check your pulses. Check the radial. Pedal. Pulses are bounding and all present. Okay. What else was there? No edema. His skin, no tenting. Skin is appropriate to race. Warm to touch. Okay, Andrew, can you
Sure. Touch your finger.
touch my finger? Touch your nose.
Cool.
Cool.
Should we do it on the other side too?
Yep, do it on the other side. Okay.
Cool.
Can you do this for me? Can you do it with your left? Okay. And I'm gonna check your spine as well.
Okay.
Make sure we got a straight spine, no scoliosis going on. We would start down here at the hips. And then up here, we're looking for alignment. It's aligned perfectly. Then I'm gonna go down. There is no curvature, perfect alignment of the spine. Okay, and then can you stand up for me? Can you walk one foot in front of the other? Perfect.